Welcome to this important video on a topic that affects many people as they age, numbness and tingling in the hands and feet, also known as paresthesia. Whether you've experienced this sensation yourself or know someone who has, it can be an alarming and uncomfortable feeling. But don't worry, you're not alone, and understanding what's happening in your body is the first step toward finding solutions. Today, we're going to explore the causes of numbness and tingling, as well as effective solutions and treatments. It's important to remember that while paresthesia can be annoying, it is often a sign that your body is trying to tell you something important about your health. Let's dive into the first part. What is paresthesia? Paresthesia is a term used to describe sensations such as numbness, tingling, prickling, or the feeling of pins and needles in the skin. It typically occurs in the hands, feet, arms, and legs, though it can affect other parts of the body as well. For some people, paresthesia is a temporary issue, caused by things like sitting or sleeping in one position for too long. But for others, it can become a chronic condition that signals a deeper health issue. In this video, we'll explain why these sensations occur and what you can do to reduce or eliminate them. Common causes of numbness and tingling. There are numerous reasons why you might experience numbness and tingling in your hands and feet. Understanding the root causes can help you identify potential issues and take the necessary steps to address them. Let's explore some of the most common causes of these sensations in detail. 1. Nerve compression or pinched nerves. One of the most frequent causes of paresthesia, the medical term for numbness and tingling, is nerve compression. This happens when a nerve is pinched, squeezed, or irritated in some way, disrupting its normal function. When a nerve becomes compressed, it may cause tingling, numbness, or even pain in the affected area. A common example is carpal tunnel syndrome, which occurs when the median nerve, traveling through the wrist, becomes compressed. This can result in tingling, numbness, or pain in the hand and fingers. It's often worsened by repetitive motions or pressure on the wrist, such as typing or using a mouse. Similarly, a herniated disc in the spine can compress nerves that lead to the legs, causing numbness, tingling, or pain that radiates down to the feet. This is often referred to as sciatica, and it can occur when the herniated disc puts pressure on the sciatic nerve, which controls sensations in the legs and feet. Other common examples of nerve compression include sciatica and thoracic outlet syndrome, where nerves passing through the neck and upper chest are compressed. 2. Diabetes and diabetic neuropathy. Diabetic neuropathy is one of the most significant causes of numbness and tingling in the hands and feet. People with diabetes often experience nerve damage due to prolonged high blood sugar levels, which can damage the blood vessels that supply nerves with oxygen and nutrients. Over time, this damage leads to neuropathy, which manifests as tingling, numbness, burning sensations, or pain, particularly in the feet and legs. The onset of diabetic neuropathy can be gradual, and it is more common in people who have had diabetes for several years. The symptoms often worsen at night and may affect both feet or hands simultaneously. Managing blood sugar levels through diet, exercise, and medication is crucial to preventing or slowing the progression of diabetic neuropathy. If left untreated, it can lead to permanent nerve damage and more severe complications. 3. Poor circulation and vascular conditions. When blood flow to the extremities is restricted or reduced, it can lead to poor circulation, which may result in numbness and tingling in the hands and feet. Several conditions can impair circulation, such as peripheral artery disease, PAD, Raynaud's disease, and deep vein thrombosis, DVT. Peripheral artery disease, PAD. This condition occurs when the arteries that carry blood to your limbs become narrowed or blocked, often due to the buildup of fatty deposits. This can reduce blood flow to the legs and feet, leading to tingling or numbness, as well as pain, cramping, or coldness in the affected areas. Raynaud's disease. In this condition, blood vessels in the extremities, usually fingers and toes, constrict excessively in response to cold or stress, limiting blood flow and causing a tingling or pins and needles sensation. In severe cases, it can cause numbness, color changes in the skin, or ulcers on the fingertips or toes. Poor circulation can also be a result of smoking, obesity, or sedentary lifestyles, which all contribute to the hardening of the arteries and reduced blood flow to the extremities. 4. Vitamin deficiencies. A deficiency in certain vitamins, particularly vitamin B12, is another common cause of numbness and tingling. Vitamin B12 is essential for healthy nerve function, and when you don't get enough of it, nerve damage can occur. Vitamin B12 deficiency can result in tingling, numbness, weakness, and even cognitive problems like memory loss or confusion. People who are vegetarian or vegan are at a higher risk of developing a B12 deficiency, as it is primarily found in animal products like meat, fish, dairy, and eggs. However, people with gastrointestinal conditions such as celiac disease or those who have undergone gastric bypass surgery may also be at risk. Other nutrients such as vitamin B1, thiamine, vitamin B6, and folate are also critical for nerve health, and a deficiency in any of these can cause similar symptoms. A simple blood test can help diagnose a vitamin B12 deficiency, and supplementation, either through diet or B12 shots, can alleviate symptoms once the deficiency is addressed. 5. Multiple sclerosis, MS. In more serious cases, numbness and tingling in the hands and feet may be symptoms of multiple sclerosis, MS, a neurological condition that affects the brain and spinal cord. MS occurs when the immune system mistakenly attacks the protective covering of nerve fibers, called myelin. This results in scarring or damage to the nerves and disrupts the transmission of nerve signals. The early signs of MS can include numbness, tingling, muscle weakness, and vision problems. These symptoms may fluctuate and come and go, often affecting one side of the body at a time. MS can also cause problems with coordination, balance, and cognitive function. If you experience persistent or progressive numbness and tingling, especially if it's associated with other symptoms such as difficulty walking, blurred vision, or muscle weakness, it's important to seek medical advice. Early diagnosis and treatment can help manage the condition and reduce the severity of symptoms. 6. Alcohol abuse. Chronic alcohol consumption can lead to a condition known as alcoholic neuropathy, a type of nerve damage caused by the toxic effects of alcohol on the nervous system. Over time, excessive drinking can damage the peripheral nerves, leading to numbness, tingling, and weakness, particularly in the hands and feet. This is often accompanied by a burning sensation, which worsens at night. Alcoholic neuropathy is typically more common in people who have been drinking heavily for many years. Nutritional deficiencies, especially of B vitamins, are also common in people with chronic alcohol use, which further exacerbates nerve damage. If you suspect that alcohol may be contributing to your symptoms, it's essential to seek help from a healthcare professional to address both the alcohol consumption and the resulting neuropathy. 7. Anxiety and stress. Interestingly, emotional and mental health conditions such as anxiety and stress can also contribute to numbness and tingling in the hands and feet. When you're stressed or anxious, your body releases hormones such as adrenaline and cortisol, which can affect your nervous system. In some cases, these stress hormones can interfere with the body's normal nerve signaling, leading to sensations of tingling or numbness. The sensation is often temporary and may occur during heightened anxiety or panic attacks. It can also be a result of hyperventilation, a common symptom of anxiety, which leads to a decrease in carbon dioxide levels in the blood, causing dizziness, tingling, and numbness in the extremities. Managing anxiety through relaxation techniques, breathing exercises, and mindfulness can help alleviate these symptoms and reduce the frequency of paresthesia associated with stress. When to seek medical attention. Now that we've covered some of the most common causes of numbness and tingling, it's important to know when to seek medical attention. If you experience any of the following, it's time to consult a doctor. The numbness and tingling are persistent or recurrent. You experience weakness or loss of coordination along with the tingling. The tingling is accompanied by pain, especially sharp or burning pain. You have a history of diabetes, circulatory issues, or autoimmune diseases. The numbness affects both sides of your body, which can sometimes indicate a neurological issue. If any of these symptoms sound familiar, it's crucial to consult with a healthcare provider. They may perform tests such as blood work, nerve conduction studies, or imaging scans to help determine the cause of your symptoms. Solutions and treatments for numbness and tingling. Now that we've covered some of the causes of numbness and tingling, let's focus on what you can do to address these sensations. Whether the cause is something temporary or a more chronic condition, there are a variety of solutions and treatments available. Let's dive into some effective approaches you can take. Solution 1. Managing diabetes. If diabetic neuropathy is the cause of your numbness and tingling, managing your blood sugar levels is critical. High blood sugar can damage nerves over time, leading to these sensations. Here are some steps to help manage diabetes and reduce neuropathy symptoms. Monitor your blood sugar regularly to keep it within a healthy range. Aim to maintain a balanced diet, take prescribed medications, and exercise regularly. Incorporate nerve-healthy foods like leafy greens, nuts, and seeds, which are rich in antioxidants and vitamins. Exercise regularly as it improves circulation and helps to manage blood sugar levels. Walking, swimming, or cycling can be great options. Consider taking nerve-supportive supplements, such as alpha-lipoic acid or B-complex vitamins, after consulting with your doctor. Solution 2. Improve circulation. For those experiencing numbness and tingling due to poor circulation, there are several ways to improve blood flow and prevent further complications. Exercise regularly. Regular physical activity helps improve circulation. Activities like walking, jogging, swimming, and cycling are excellent for promoting healthy blood flow. Massage therapy. A gentle massage can stimulate blood flow and help reduce symptoms of poor circulation. Try using essential oils such as peppermint or ginger, which can help to warm and invigorate your muscles. Elevate your legs. If your hands or feet are affected by poor circulation, elevating them while resting can help to improve blood flow and reduce swelling. Compression socks or gloves. These specially designed garments can help improve circulation by applying gentle pressure to the limbs. This can reduce the tingling and numbness caused by poor circulation. Solution 3. Nutritional support and vitamin deficiencies. If a vitamin deficiency is contributing to your paresthesia, here are some steps you can take to replenish the nutrients your body needs for proper nerve function. Vitamin B12. Make sure you're getting enough vitamin B12, which is essential for nerve health. Foods rich in B12 include fish, poultry, eggs, and dairy products. If you're a vegetarian or vegan, consider taking a B12 supplement. Folate, vitamin B9. Folate is another vitamin that supports nerve health. Sources of folate include leafy green vegetables, beans, and whole grains. Vitamin D. Low levels of vitamin D can also contribute to nerve problems. Ensure you're getting enough sunlight, or consider taking a vitamin D supplement if necessary. Magnesium. This mineral helps with nerve function and muscle relaxation. Include foods such as spinach, almonds, avocados, and bananas in your diet. In some cases, a blood test can help determine which specific vitamins or minerals are deficient in your body, allowing for targeted supplementation. Solution 4. Physical therapy and nerve stimulation. If nerve compression or pinched nerves are the cause of your paresthesia, physical therapy might be a valuable solution. A physical therapist can guide you through exercises that target specific muscles and nerves, helping to relieve pressure and improve mobility. Some techniques and treatments include stretching exercises to relieve nerve tension, strengthening exercises to support muscles around the affected nerves, reducing pressure, heat therapy and cold packs. Alternating between heat and cold on affected areas can help relax tight muscles and reduce inflammation, providing temporary relief. For more severe cases, doctors may recommend nerve stimulation techniques such as TENS, transcutaneous electrical nerve stimulation, which uses electrical impulses to reduce pain and improve circulation. Solution 5. Stress management and sleep. Stress and anxiety can play a significant role in triggering or worsening numbness and tingling. The release of stress hormones can interfere with your body's nerve function and circulation, so it's crucial to manage stress and prioritize relaxation. Here are some ways to reduce stress. Practice deep breathing exercises. Take a few moments throughout the day to focus on your breath. Techniques like diaphragmatic breathing or progressive muscle relaxation can help lower stress levels. Try meditation or mindfulness. These practices can help calm your nervous system and improve your overall sense of well-being. Engage in activities you enjoy, whether it's reading, gardening, listening to music, or spending time with loved ones. Activities that make you happy can help reduce stress. Prioritize sleep. Lack of sleep can exacerbate numbness and tingling. Aim for 7-9 hours of quality sleep each night to allow your body to repair and restore itself. Try to establish a bedtime routine. Avoid caffeine in the evening and create a relaxing sleep environment. Solution 6. Avoiding alcohol and smoking. If you experience numbness and tingling due to alcoholic neuropathy or circulation issues, it's important to reduce or eliminate alcohol consumption. Chronic alcohol use can damage nerves over time, leading to symptoms of paresthesia. Similarly, smoking can constrict blood vessels and reduce circulation, worsening symptoms of numbness and tingling. To improve your overall health and nerve function, consider reducing or eliminating alcohol and quitting smoking if applicable.